Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, Professor, and then all the committee team and all the participants. So here I want to share about the prevalence of squalene epoxidase mutation in terbinafine resistant. It's a systematic review. I'm very glad to this opportunity. Thank you. My name is Vika Humida Silmi. I'm from Universitas Gajah Mada. Okay, first is if I ask all the participant, what is the most prevalent dermatologic disease in the world? Guess what? Okay, the answer is the dermatophytosis is the most prevalent dermatologic disease. It's affect around 2.1 billion of cases in the world, and I think that's a huge cases, yeah. And then dermatophytosis cause substantial burden on patient. Actually, it's mild disease, but if it left untreated, dermatophytosis might cause significant morbidity, including cellulitis and ulcers, and then that's a problem for dermatology. And then dermatophytosis also significantly impacts economically, around $8,000 million in US, and I think in Indonesia also impacts economically, but there is no result, yeah. And then here is the pathological of the how the dermatophytosis infect the skin. So the dermatophytosis need to destroy the keratin-rich layer of the skin, and then the important part atau important component of the fungus is the cell membrane called ergosterol to destroy the keratin-rich layer of the skin and then to infect the people. Okay, here's how the ergosterol this is how the ergosterol is work. First, from the nucleic acid synthesis, and then from the squalene. Squalene need the squalene epoxidase to form lanosterol, and then lanosterol need lanosterol demethylase to form zymosterol, and then zymosterol from the phycosterol, and then from the result they form ergosterol. And this ergosterol that destroy the keratin layer of the skin and infect the people. That later we can call it dermatophytosis. And then the question is where the terbinafine works in this dermatophytosis cases, and then the answer is terbinafine work in the inhibit the squalene epoxidase enzyme. So the terbinafine inhibit the squalene epoxidase enzyme, and then after the squalene epoxidase enzyme is inhibit, so the rest of the process to form ergosterol is not happening. Okay, this is the background and the objective. So the resistance of the antifungal treatment can be caused by several underlying factors, including suboptimal dosing, topical steroid misuse, or dysregulated host immune response. And then molecular mechanism of dermatophytes recalcitrant are attribute to gene mutation of several target enzyme or interaction disruption between drug molecule and fungal enzyme. In terbinafine resistance, a gene mutation that encodes squalene epoxidase or SQLE was reported as the underlying mechanism. However, the global prevalence of SQLE mutation in terbinafine resistant is not available yet. Therefore, in this study, we review literature that study SQLE mutation in dermatophytic treatment to understand the global prevalence of SQLE mutation. Okay, first we start with the question. what is the prevalence of squalene enzyme mutation in terbinafine resistance? Again, we use PICO to determine that. The problem is dermatophytosis, and then the intervention is squalene enzyme mutation, and then the comparison is without squalene enzyme mutation, and to see the terbinafine resistant. Okay, this one, the eligibility criteria for this systematic review. For this first one is study within the last 5 years, and then the paper written in English, and then performing antifungal susceptibility testing or AVST for terbinafine in vitro isolated. Okay, and then the result is, okay, here we have like 6 study from many countries in the world. There is Switzerland, India, Denmark, Germany, Poland, and Belgium. The result is that the squalene enzyme mutation is about 80.28%. And I think it's a huge amount of percent for the cumulative prevalence. And then we found 57 out of 71. And then the terbinafine resistant is defined following EUCAS definition that minimal inhibitory concentration 50 or MIC 50 is more than 1 milligram per liter after 5 days of incubation in the growth medium. Okay, this one is we try to find more about the what kind of squalene enzyme mutation in this dermatophytosis cases, and then here example for the leucine 393 phenylalanine, and then phenylalanine 397 leucine, and the other, and the most squalene enzyme mutation is L393 phenylalanine or phenylalanine 397 leucine. And then here is the prevalence of the terbinafine resistant around the world. For the first one in Switzerland, and then India, and then Denmark, and then Poland, and then Germany, and then Belgium. And here the result that global prevalence of squalene enzyme mutation is around 80.28%, and it's huge amount, yeah, I think, because from 57 out of 71 we found. And then squalene enzyme mutation is leucine 393 phenylalanine, and then phenylalanine 397 leucine, and mean MIC 50 is 13.53 milligram per liter. As I mentioned before, that the mean MIC 50 should be greater than 1 milligram per liter. And then the result is 13.53, so it's so high from the baseline. And then here is the conclusion that the first one is terbinafine resistant in dermatophytosis is an emerging global health issue, because it's not just about a medical issue, it's also affect a social and economic issue in around the world. And then global prevalence of squalene enzyme mutation is about 80.20%, and it's huge. And that mean MIC 50 among squalene enzyme mutation is 13.50 milligram per liter. As I mentioned before, that the baseline is more than 1 milligram per liter. So, with the increasing report of dermatophytes recalcitrant, prevalence of HQLE or mutation may be reviewed to understand the molecular mechanism as well as to review strategy to solve the terbinafine resistance. So we hope there is a good outcome in the future. Thank you. That's all my presentation. Looking forward for the good discussion with all the participants. Wassalamualaikum warahmatullahi wabarakatuh.